So imagine you've been going to your primary care doctor for 20 years and all of a sudden your doctor leaves, passes away, something happens, and you find yourself trying to figure out how to find another doctor, how to make your health decisions. You're dependent on this physician for so many years, and in a way, this physician maybe even made a lot of your health decisions for you. So now you feel stranded, you feel bewildered, and probably even let down by this doctor. My name is Dr. Mo, family medicine physician here at Digital Nomad Health. Welcome, and thank you for checking out this video. Patient empowerment, empowering the patient, to me is incredibly important, because the last thing I want is for one of my patients to feel that they are dependent on me for everything, that I am their source of health, healing, any of that. I don't want that. I want my patients to feel that sense of empowerment that comes with having adequate knowledge about their body, their health, their mental state, everything that has to do with their day-to-day life and lifespan, health span, longevity, everything. To me, patient empowerment means that I am educating that individual. I'm giving them all my knowledge, all of my expertise, and I am helping them tap into their own and bring out all of the resources that they're capable of summoning in order for them to maybe have an easier time to heal, maybe make their journey through life and their health a little bit easier and obviously a little bit more effective. Fortunately, in healthcare, there is a movement towards patient empowerment, shared decision making, but it doesn't always happen. Many of us, I mean, I'm a doctor, but I'm also a patient. I go to a physician and I'm being talked down to, or I'm being told how to do things. And there's that kind of paternalistic person. It could be a man or a woman, but it is that person, authoritative, standing there telling you how things should be, how they do things, and that there is really no other way of doing it. And that really makes a patient kind of contract instead of open up to that physician. And this patient-centered care is a wave of the future in healthcare. And that is what I want to help my patients channel more, but I also want you to understand, as somebody who's listening to this, whether you're a physician or one of my patients, that as part of the patient empowerment, you need to use that physician, you need to use me as an asset, as a resource. You come to me for knowledge and information, you use me to help you process your decision matrix and make the right and best health decision for yourself at the time. To me, patient empowerment means that my patient understands that their decisions, their day-to-day decisions, has an impact on their health, number one. Number two, that they can change their decisions, that they have the power, the authority to be able to choose option 2 instead of option 1, option B instead of option A. And finally, that they recognize and understand that if they make this change, then they'll likely have this outcome. If they don't make this change, then this other outcome is more likely. That, to me, is the essence of patient empowerment, and something that I can sort of create by educating my patient and communicating with them in a way that they understand that they're sort of in charge of their health. They get to decide, in some ways, they get to decide how their body behaves, how they feel within their body. But of course, there are certain barriers. If you've grown up in a household, if you are of a certain gender, identity, race, where you've been maybe treated a little bit more in that condescending fashion, you may not feel that authority, that feeling of power where you can make a decision for yourself and have the confidence that even if you're wrong, you made the best decision in the moment, and that now you can take the outcomes of that decision to drive better future decisions, if that makes sense. So if I make a decision today, well, maybe it wasn't a good decision in hindsight, but it was the best decision in the moment. And if I can just take a few more days to live with this decision and see what the consequences are, then I can look back and say, hey, you know what? I wish I would have done something different. Number one, the ability for you to be able to channel that. But number two, for your physician to be able to tell you constantly like, hey, look, we can just give this a try. You got really bad hemorrhoids. Why don't we give this diet a try? You got really bad constipation. Let's give this a try. Why don't we try this medication? See how you do. And you can come back and tell me how do you feel today? What changes do you think we should make? What are your thoughts? Do you think you want to try a different medicine? Why do you want to try a different medicine? This kind of me helping that patient dig deep into them to be able to express everything that's there and formulate these thoughts so that they can be their own doctor, essentially. In some ways, I think the healthcare system, because it is so chaotic and in many different ways non-functional, but in many ways very functional, it puts the patient in a position of feeling helpless, right? There's no cost transparency. You have multiple different people coming into the room. One's an RN, one's an LVN, one's an MA, one's an MD, one's a DO, PA, NP. I mean, for us physicians, it's even hard to keep track of all of this. Many times I've been in the hospital myself as a patient or gone to a doctor and I don't really know who I'm interacting with. And I'm too shy and too embarrassed to ask a question. So in a way, our healthcare system, I think, does create that. But if you have a good physician, that physician will constantly be aware of these forces and they will teach you, they will empower you, they will educate you so that you become your own best advocate and make you feel like you're in charge of your health. Probably the most powerful things that can make you a very empowered patient is to be with a physician who wants to empower you. A physician who doesn't just want you to be dependent on them and for you to come to them for all of your healthcare needs, but a physician who's gonna ask really good questions that's gonna put you in the driver's seat. The way you want to be the CEO of your body and your health, but you want the physician to be kind of that risk person, right? What is that? The risk officer of your of your entity, so that you can go to that person and say, okay, what about this? What about that? All right, yeah, I think we could try that. I don't know, I think that might be a bit risky, or I would recommend doing this over this. But you in the end are the one who is taking in all the good information and making good decisions. The physician is providing you with the most up-to-date options, with the most up-to-date resources, and the most accurate resources. As a patient, you should be very comfortable asking a lot of questions, and your doctor should be very open and very humble. One of my best surgeons that I ever had, out of all the surgeries that I ever had, was a hand surgeon who really asked good questions. And when I asked a question that he didn't know, he's like, I don't know. I guess it would be probably something like this and maybe something like that, and we'll just find out when I do the surgery, but I probably would think this and I think that. He would think out loud with me. And that made me feel confident. That made me feel like I wasn't sitting in front of this person who thinks of himself as a god or authority on a topic, but more of a person who related to me on my level. So being proactive in your healthcare means that you seek out multiple different opinions. I want my patients, I want you guys, hopefully if you choose me as your physician, to come to me for information, but I also then want you to use that as kind of a jumping off point to go and research it even more. For example, I might have a very Western medical approach to a certain topic, but you might go research something in Ayurveda, or you might research something in integrative and functional medicine and bring that back to me. And hopefully I have enough knowledge about that we can have a deeper discussion and both of us go on to research this even more, learn more. But you are always left feeling empowered, knowing that you can come to me as a good source of knowledge and information. So be willing to ask questions, get second medical opinions, and use your physician as an asset and a resource, but not as somebody who is the final authority figure that will tell you this is how it should be done and there is no other way. That is probably a good way to end up in a bad relationship with the doctor. Most doctors don't want that kind of patient. And in the end, you're not gonna feel empowered. You're not gonna have that autonomy over your health. I remember sometimes in the urgent care, somebody would come in and they have a primary care doctor. Maybe they just never felt really close to their primary care doctor. So they come into the urgent care and they're like, Dr. Mo, I gotta ask you this. I'm really afraid of stopping this anticoagulant, or I'm really afraid of stopping this steroid because I'm thinking this is gonna happen, that's gonna happen. One, I could practice defensive medicine and say, absolutely, you should not stop that medicine. Two, I could say, well, you can stop it for 4 days and then you can restart it. And in a way, I didn't really explain anything. I didn't empower the patient. They still feel dependent on me to make the decision But the empowerment version of that would be, well, what are you afraid of? Well, I'm afraid that I'm going to get a heart attack in these 2 weeks that I might try to stop this to see if these other symptoms get better, because I really think my side effects are from this blood thinner. Okay, well, the chance of you having a bad outcome from stopping this blood thinner for just 2 weeks is incredibly unlikely. And if you ever feel too worried and you just can't get any sleep because you stopped it, you can always restart it. So one option might be to stop it and just see how things go, and then you can always restart it if you don't see any change in your symptoms. So what I'm doing here as a physician is I'm explaining my thought process of how I would decide whether somebody should or shouldn't stop their anticoagulant. And now the patient can go decide what to do instead of me deciding for them. So I hope this is helpful. I hope you can get yourself to be more empowered, to be more dynamic in your engagement with your physician. If you're interested, being my patient, if you're interested in me being your doctor, go to digitalnomadhealth.com. I'm a board certified family medicine physician. I'm licensed in California and Alaska. I do one-on-one consultations, 1 hour long appointments, but I also do a membership type practice where I will be your doctor. We work together long-term to ensure that you stay healthy and prevent long-term chronic medical conditions, which nobody wants. All right, guys, take care.